because we have Dr. Brian Garibaldi joining us. He is with Johns Hopkins Biocontainment Unit. He's the medical director, and thank you for being here. That's got to be encouraging that the Pfizer vaccine has that efficacy so high about asymptomatic transmission. Could we expect that the other vaccines will probably have some kind of similar results?
I would think so. I think it's also important to look at what viruses are circulating in Israel right now. They have a high percentage of people who are infected with the B.1.1.7 variant from the UK, which suggests that, at least from the Pfizer data, that vaccine is likely to be effective against that variant. The other news is that Moderna is now looking at a new vaccine that's targeting the South African variant. They just are starting to enroll patients in a trial that's going to give either a combined vaccine that's been targeted with the initial variants of the virus, but also against this South African variant, as well as another shot of the regular vaccine to see how that performs against these other variants.
Doctor, there's been lots of questions about some of the steps that states have taken across the U.S. over the past couple of weeks. Texas this week scaling back or eliminating their mask mandate. They're allowing businesses to operate at 100% capacity. Any fear there that we could reverse some of these gains that we've made over the last 6, 7, or 8 weeks?
Yeah, I think that is a very real concern. We've made great strides over the last several weeks, but when you look at where we've been, it's been a marked improvement, but we're still having close to 60,000 new infections per day. The only country with a higher per day infection right now is Brazil, and we're really worried about what's happening in Brazil, being a hotbed for potential new variants and their health system struggling, particularly with hospitalized patients. So even though things have gotten better, we have variants on the rise. We're doing great with vaccines right now, but we still have only had about 20% of the population vaccinated, so the vast majority of the country remains vulnerable. So I think it's too early to be pulling back. We're very much at risk for a fourth surge if we're not careful.
Doctor, if I'm going to botch this as I ask you the question, so correct me, but you'll understand the genesis of it. If what we do in New York is different than what they do in Texas, and yet the per capita death rate, and I don't want to minimize the tragedy of this, is essentially worse in New York than in Texas, and maybe Texas is doing the right thing opening up?
Well, I think there's lots of things to the per capita death rate, and I think if you remember what happened in early spring last year in New York, initially the death rate was really being driven by home patients and people with high health comorbidities. So it's not just the per capita death rate, it's who's actually becoming infected and what that burden is on the healthcare system. So while death rates are definitely coming down, we're still having almost 2,000 deaths per day. And I think it's very likely that we could see a rise in those hospitalizations again if we start to see this flattening out across the country. And cases are on the rise in New York, they're on the rise in California, they're on the rise in Texas, they're on the rise in New Jersey. So the vast majority of the country has had good gains. There are places where we're starting to see those cases start to rise again. So, we're not out of the woods yet. We're doing better than we were several months ago, certainly. This is the best we've looked since Halloween, probably, but there's still a lot of anxiety about what happens next if we're a little bit too aggressive in reopening. We've seen this happen 3 times, right? Every time we reopen aggressively, we've seen a resurgence of this virus. Things are different now, obviously, now that more people have been vaccinated and more vaccines are on the way, but I think we need to be careful.
Dr. A lot of that anxiety that you're talking about rests on whether or not, or how quickly, I should say, we get the population vaccinated. We have states and cities that are setting different rules when it comes to vaccine eligibility. I'm curious if you think this has slowed down the process at all, or if there's any harm in doing this?
Well, I think it's been hard to, switch from having a state-run response to the virus to now have a federal presence in trying to, provide recommendations about mask wearing, about travel, about how people can interact with each other, and seeing a much, I think, stronger role of the CDC and the White House in trying to set policy. And so it takes time to, I think, steer away from those local jurisdictions and have more of a federal or overarching response. But I think it does potentially, send the wrong message if we're not transparent about how these vaccine rules and regulations or recommendations are being made. And certainly we're still seeing, large groups in the population who have lower vaccine, not acceptable, lower access to the vaccine. And I think that's something that we have to be really mindful of as well.
We appreciate your being here, Dr. Brian.